Hello everyone, my name is Isaac from International Marketing Department at VINNO, and welcome to today's new product launch event. Today is an exciting day for VINNO, as we are going to present you two of our latest ultrasound systems to address the various needs for ultrasound in different scenarios. At VINNO, we've never stopped pushing boundaries of where ultrasound can go and what it can do. Over the last decade, we've launched cart-based ultrasounds from primary care to secondary care settings. The point-of-care ultrasounds from portable to handheld categories. Just recently, the brand new Ultimus 9E, built upon the world's leading sonographic technology, has been launched. There's always an ultrasound from the portfolio ready for you. With you in mind, we bring you R700 and V10 today. The two systems are built upon the powerful VLucid technology to address today's clinical challenges for global physicians. The challenge for ultrasound to produce precise diagnosis because of the obesity of the rising population, the challenge for higher efficiency at diagnosis due to the increasing patient throughput, the challenge for the inadequate knowledge of sonography for the real-time decision-making. No matter which is your using scenario for an ultrasound, either one would fit your needs, and more importantly, to offer you a problem-solving solution to reassure you and your patients. Now, I'm going to start with R700, the card-based high-performance ultrasound system. With extra-wide monitor, tiltable large touchscreen, built-in battery, and easy-to-use workflow, R700 provides you a comfortable scanning experience. Imaging excellence and powerful quantitative measurements drive your practice efficiency ahead. Imaging quality always comes first for you to determine the diagnosis. The timely and accurate diagnosis always comes priority for you to offer a patient the best opportunity for a positive health outcome. What have been in the way of getting there, and what we could help you with that? A missed or delayed breast cancer diagnosis may result in more advanced cancer, more aggressive treatment, and a worse outlook. However, it also concerns us that many women have been falsely conducted with unnecessary biopsy, damaging physical and mental health of them. Is there anything we could do about it? Do we have a more effective and easier measurement for echocardiography, so everyone could use ultrasound smart and faster? You will find all the answers for the next part. The solutions R700 could address today's challenges in general imaging, women's healthcare, and the cardiovascular. Let's get it started.
I am a diagnostic radiologist specialized in abdominal imaging. I really love being a radiologist. Imaging is such an important part of patient care, being able to see the patient from the inside out, so to speak. In the emergency setting, we help make the difficult first diagnosis. In the outpatient setting, we are the key in determining the patient diagnosis and excluding diagnosis as well. From the last 5 to 6 years, we've been undergoing a great pressure of increasing overweighted patients, which I believe has been a global challenge for the radiologists. The obesity of the rising population has made the ultrasound's potential difficult to achieve a precise diagnosis. Obviously, the first things I need for an ultrasound is a high-quality B-mode image, which is the most important issue for diagnosis. And you also need a good Doppler. Besides the unique physiologies and anatomies such as water percentage, muscle mass, bone density, and so on of the patients. The ultrasound image quality is getting worse because of the fat, For example, the abdomen organs, where the fat is easy to accumulate, high-resolution 2D images are required for HCC and multiple hepatic nodules, hepatic vessels, and gallbladder polyps require high-resolution and high-sensitivity capture of low-speed blood flow. Second is when you think about working with the routine of standard patients and outpatients, they come and go. It's more important to have an easy-to-use equipment because they will save you the time and the way of connecting, of moving the probe, of cleaning, disinfecting. When you think about the patient in the ward, but very often you have to move your equipment from one room to another one. It's also important that this does not take too much time. For instance, switch on, switch off. The system will take a long time. This will not be very comfortable for the patients to be investigated at the bedside. When R700 came to our department, when I see the image, I was surprised. Very clear and crisp image. I was excited to see both high-resolution B-mode and high-sensitivity color Doppler in dense organs. The large-size touch panel helps a highly user-friendly workflow, such as easy user-defined presets, comments, and measurement customization. When I share the system with my other colleagues, I'm able to find my preset on the home page. Very easy to get it started with. I also like the view report function creates customized report template easily. I enjoy working with it. It makes my daily work easier and faster. And I also specialize in hepatology. You cannot have the liver patient without having the possibility to palpate the liver and to palpate with ultrasound, which means elastography. We can see many patients are overrated and shifting from viral disease to metabolic patients, which is a big amount. You have to deliver the optimal care, which includes the elastography. We all know that obesity is associated with liver abnormalities, such as metabolic dysfunction, associated fatty liver disease, aka MAFLD. It's a new terminology update from non-alcoholic fatty liver disease. We found that more than half of overweighted patients can be diagnosed as MAFLD. Its a major consequence is increasing deposition of fibrous tissue within the liver, leading to the development of cirrhosis, which in turn may give rise to portal hypertension, hepatic insufficiency, and hepatocellular carcinoma. So we have to define the stage of fatty liver for better treatment for the patient. We need ultrasound with shear wave elastography to do that. Shear wave is better than strain as it can get a quantitative result, repeatable, and not depend on the doctor. Using VINNO's V-shear is quite simple, follows a protocol for patient preparation, imaging segments, ROI, placement, patient briefing, and measure on the appropriate image and area. Measurements should be obtained based on high quality of the B-mode, which could be challenging as most of the MFLD patients are overweighted. R700 improves efficiency, increase accuracy and standardization, and improves the quality of patient care. I believe the future of our radiologists will be able to fuse and integrate such multi-scale and multimodal information into diagnostic radiology. Also, diagnostic radiology has been frequently interacting with other disciplines such as nuclear medicine, molecular imaging, neurology, oncology, cardiology, pathology, surgery, and laboratory medicine, and it will be vitally important to develop new approaches and paradigms for us to collaborate with other physicians as a team. I'm also a fan of big data and AI, how to improve the accuracy, efficiency, and productivity in diagnostic radiology by incorporating novel information technology and AI system will be a grand potential to relieve our workload. Give us more time for complex cases, expediting normal cases, and increasing patient satisfaction.
As a radiologist specialized in breast imaging, my job is to perform diagnostic breast procedure that can help diagnose and treat breast cancer. As you know, breast cancer is the most diagnosed cancer in the world. It accounts for 25% cancer cases among women, and it's a leading cause of death from cancer in the women too. Survival rates for breast cancer are very high actually, if the cancer is detected early and where treatment is available. Unfortunately, 50 to 80% of breast cancer cases are diagnosed at advanced stage in many low and middle income countries, when the cancer is more difficult to treat, is more expensive to do so, and is usually incurable. Early detection is the key, as a breast ultrasound is one of the fundamental tools in early detection with non-invasive, painless, and non-radioactive. Breast ultrasound has several advantages compared to other imaging modalities, including relatively low cost, lack of ionizing radiation, and the ability to evaluate images in real time. In particular, ultrasound is especially effective at distinguishing solid breast masses from fluid-filled cystic lesion. In addition, breast ultrasound is able to detect cancers obscure on mammography, making it particularly useful in diagnosing cancers in women with a dense breast tissue. The problem is, interpreting breast ultrasound is a very challenging task. When we evaluate ultrasound images, we use different features, including lesion size, shape, margin, echogenicity, posterior acoustic features, and orientation, which are very different from patient. Therefore, to determine if the image findings are benign, need short-term follow-up imaging, or require a biopsy based on their suspicion of malignancy. The reality is, there is many false positive findings with ultrasound. Compared to mammography alone, the addition of ultrasound in breast cancer screening leads to an additional 5 to 15% of patients being recalled for further imaging, and an additional 4 to 8% of patients undergoing biopsy. However, only less than 10% of biopsies prompted by screening ultrasound are found to identify cancers. So my conclusion is, breast ultrasound has been proved to have high false positive rates. The question is, what can we do? I have learned that AI system could achieve radiologist level accuracy in identifying breast cancer in ultrasound images. With the help of AI, we could decrease the false positive rates and reduce request biopsies by 30%. This high potential of AI in improving the accuracy, consistency, and efficiency of the breast ultrasound diagnosis interests me a lot. With this in mind, I tested R700 and find it very interesting. It has a breast-specialized linear transducer with a large field of view and high-resolution images, providing excellent 2D image. The V8 breast, which is with deep learning technology, has a very high detection sensitivity for small cysts and produce clear lesion boundaries. What makes it more interesting in that, unlike other deep learning function for breast in the market, V8 breast can detect lesion in real time and gives auxiliary diagnostic result immediately. It automatically detects and recognizes the single or multiple lesion during the scanning, show the lesion in boxes with benign or malignant indication. The measurements of the lesion and by rates categorization will be displayed as well. So, data can quickly judge all possible lesions without being interrupted, greatly improves the efficiency and accuracy of my daily routine. In the past, only a few of my colleagues with experience are able to do breast ultrasound. Some of the patients have to wait several weeks because of the limited experienced doctors. With this V8 breast, what we basically need to do is scanning. It is almost able to produce diagnosis as accurate as experienced radiologist. Any doctor can do it. The most significant benefits is for the patient. The V8 breast detects the lesion that we may ignore, which means the early detection of the breast cancer is feasible. It also has a great potential to significantly improve our efficiency, reduce our workload, and reduce almost 30% of request biopsies. It's a great news for both patient and doctors. I believe R700 could be a potential system for breast ultrasound.
I am a cardiovascular specialist. About 1/3 of the people died of cardiovascular disease every year. With more and more people of the aging, rising blood pressure and other factors, arterial elasticity will gradually decrease and stiffness will increase. And the arterial stiffness is closely associated with atherosclerosis and is an independent predator of CVD. The good news is up to 90% of CVD may be preventable. The bad news is the mild atherosclerosis usually doesn't have any symptoms. Therefore, it usually be ignored. Arterial stiffness is one of the earliest detectable manifestations of adverse structural and functional changes within the vessel wall, and it can be assessed by carotid femoral pulse wave velocity. It is considered as the gold standard measurement of arterial stiffness. Carotid femoral PWV is simple, non-invasive, reproducible, and highly predictable for CVD. Is one of my research directions. I usually use ultrasound to measure PWV values as it's relatively low cost, convenient to operate, and highly consistent with other invasive catheter methods. However, there is a problem here. The measurement of carotid femoral PWV can only be completed manually, and it takes a long time and has a high dependence of the operator. These shortcomings slow its application in routine clinical examinations. I was looking for a more efficient way to measure carotid femoral PWV. Here comes R700, a modern ultrasound with automatic measurement of artery stiffness, AMAS. Then I started to evaluate the results from both conventional Doppler way and AMAS. First of all, the measurements from AMAS exhibited an excellent consistency with the conventional Doppler approach. Secondly, it takes only 1/3 of the time needed for the conventional Doppler approach. This is a huge step forward for carotid femoral PWV measurement. Let me show you how does the AMAS work on the system. Once the ECG is set in place, I acquire the carotid and femoral arteries and save the images. Then you start AMAS. Check again the carotid data. The system will automatically get the T1 that from ECG R wave to the systolic point of carotid PW waves. After that, we need to select the femoral artery PW waves to get the T2 from the ECG R wave to the systolic point of the femoral artery PW waves. The system will automatically to get the difference value from T2 and T1. Finally, you tape measure the distance from the carotid to femoral arteries and type in the value. You will get a PWV immediately. The age dependence of PWV values was confirmed. PWV progressively increases 6 to 8% with each decade of life, and even more profound after 50 years old. PWV is increasingly being considered in hypertension clinical guidelines. For example, the 2018 European Society of Cardiology and European Society of Hypertension guidelines for the management of arterial hypertension, including PWV, as an index of aortic stiffness and underlying arteriosclerosis as part of the assessment of the hypertension-mediated organ damage. We know the PWV is assessed by dividing travel distance by travel time. The validation of the travel distance measurement is very important for an accurate result. Another interesting study was being shown that the tape measure distance from carotid to femoral artery multiplied by 0.8 corresponds best with the real traveled aortic path length measured by MRI, which is of course influenced by age and minimally by BMI. With this, we may be able to promote the application of the carotid femoral PWV with high clinical significance. I believe that AMAS will be widely used in predicting cardiovascular events, especially be considered in hypertension clinical guidelines. It has shown the potential for early CVD assessment and eventually saving more patients from CVD. Of course, there are some negative influences to the heart health, also may cause CVD. Cardiac hypofunctions recently attract more and more attention. Another interesting feature from R700 is called VCQ, which provides the instant indication of the common echocardiographic measurements, such as ventricular dimensions and LV mass in male and female. VCQ gives above or below indication according to the normal reference value based on WASE and ASE. This is an ideal ultrasound for cardiovascular specialists with B-mode and Doppler images performance for heart structure and hemodynamics, the novel IMAS for early prevention of atherosclerosis, and also the strain images for early detections of subclinical left ventricular dysfunctions. R700 is certainly more than what I expected.
Welcome back. R700 is designed with you, your challenges, and your patients in mind. You are devoted to providing the high-quality patient care. We are committed to providing the product to help you achieve that. The product shall also be affordable and approachable for most physicians because the patient care matters the most from the day you start with your medical career. R700 comes high quality but affordable. To have more patients be able to experience a better healthcare is what we think R700 could bring to the world. We hope you enjoy using it and excelling yourself every day. Despite all this, there's always certain scenarios needed the ultrasound with possible lightweight, portable capability of being transported easily, but without compromise in imaging quality because of the downsides for a real-time decision-making under circumstances, such as emergency, surgery, and sports medicine. That's why VINNO 10 comes. VINNO 10 is our first portable system empowered with VLucid technology to ensure its imaging excellence as same as a consular ultrasound. As always, ease of use is paramount. Rapid boot-up times and the simplified workflow help you in using the ultrasound into real-time decision-making. The capacity for image storage and remote solutions provided by the inbuilt flying sonar allow you to get support from others remotely. Let's get to know the VINNO 10. The product manager, Chao Chi, will take you to where VINNO 10 belongs.
Hello, I'm Chao Chi, the product manager at VINNO. As we all know, the expectations for ultrasound at certain circumstances are very different, such as in emergency medicine. This examination has limited goals that allows the physician to make rapid decisions, identify life-threatening diagnosis, and expedite the operative management of emergency patients. This type of examination, therefore, is very different from that performed by radiology technician, radiologist, or cardiologist. That is why the highly portable and easy-to-use V10 with uncompromised premier imaging quality allows the emergency physician to immediate imaging, giving them the means to make management decisions quicker and improve quality of care. What is the most crucial factor for emergency department? The time. However, the diagnosis of uncertain pathologies may take some time with even unnecessary interventions for the patients. Using an ultrasound at the bedside can reduce medical errors, provide more efficient real-time diagnosis, and in certain clinical scenarios, supplement, or replace more expensive imaging modalities such as CT, and reduce patient exposure to ionizing radiation. However, in the emergency department, the console ultrasound seems clumsy and slow with the size and the complex operation. For instance, the chest pain often is associated with dyspnea, or shortness of breath, which is one of the most common causes of ER access, accounts for approximately 20% of emergency admissions. Any delays in the investigation and management of these patients would be a big problem. The origin of these symptoms is often sought in heart and lung diseases. Sometimes are not possible to clearly identify the underlying cause, which may cause the patient to have to return to the ER. In other cases, while it's possible to identify the underlying cause, it is necessary to perform a large number of tests before being able to make a diagnosis. The patient has to go somewhere else to get it done and come back, having somebody monitor them. There are many patients who would not have lived had they gone to different departments. Having V10 available at any time simply lowers the threshold for life-threatening conditions. You want answers, you want accuracy, and V10 gives you that. V10 is the first portable ultrasound empowered by the VLucid technology. It enables you to experience the imaging excellence at the console performance with crisp images in a portable fashion that is simple, fast, and precise. V10 helps physicians easily capture the hypoechoic material between the two layers of pericardium, which allows us to make a quick diagnosis of pericardial effusion and to diagnose much more dangerous clinical pictures, such as cardiac tamponades. Acute heart failure is another common presentation to the ED. Heart ejection fraction is an indicator calculated by Simpson for judging heart failure. The most complex part in this measurement is to trace endocardial boundary manually in a cardiac section image, containing dozens of points. For emergency, every minute costs a life. VINNO's auto-EF provides much easier evaluation with auto-detection of cardiac planes and myocardium borders, auto-recognition of systolic and diastolic images, and auto-measurement of EDV, ESV, EF. It is a valid supplement to the clinical assessment of ejection fraction in the hands of less experienced physicians, delivering fast, simple, and precise diagnosis. As for the lung inspection, the detection of pleura is the way to access. If the chest pain is related to respiratory system, pneumothorax is the common and life-threatening clinical condition, which may require emergency treatment in ED. V10's auto-pleural function, with just one click, automatically identifies the lung sliding, bead lines, and the lung point, contributing to the diagnosis of pneumothorax. It also measures the thickness of pleura, which helps the diagnosis of pleurisity along with some other tests. For physicians with insufficient ultrasound experience, the autopleural provides a rapid and accurate pneumothorax solution, and the light-weighted portability makes V10 accessible to the patients anywhere. In the ER, where time is critical, V10, which provides instant and full diagnostic capabilities at the bedside, would be the stethoscope for all ER physicians. It's easy to move around, fast, and simple to use. Same console imaging quality, with the precision at the point of care, saves lives and increases the patient safety and improves clinician efficiency. When you go to the operation room, you may also find the V10 there. Hepatocellular carcinoma is the third leading cause of cancer-related death worldwide. Radiofrequency ablation, aka RFA, is considered as an effective local regional treatment modality for HCC, especially for the elderly patients or those with surgical intolerance. Indeed, studies have demonstrated that RFA of early-stage HCC can provide comparable overall survival to surgical resection. However, the incidence of local tumor progression after RFA is significantly higher than that of surgical resection. To overcome this limitation, the technique that will be helpful in this regard is using ultrasound imaging, which helps to not only more accurately determine by the guard lesion by enabling the RFA of small, poorly visible or invisible tumors, but also can determine the ablation margin. Does that mean RFA is a safe deal? Absolutely not. We know that the liver moves three-dimensionally during the patient respiratory cycle, and the liver volume can also change during the respiration to some degree. Ultrasound scans of the liver are frequently obtained in oblique, axial, or sagittal planes rather than the true orthogonal plane, while liver CT or MR images are routinely achieved in orthogonal planes. Therefore, during the procedure, the operators need to mentally register the reference images of the liver CT or MR examinations. Sometimes there is difficulty in the mental registration and the possibility of error during the mental registration. Furthermore, during the RFA procedure, any change of the body position from the pre-examination, such as during the anesthesia, the accurate location of the liver tumor could be slightly changed, which could result in mistargeting of the lesion or incomplete ablation. This is where VShare comes in place. VShare, as the simultaneous emission of single-point multi-line dynamic aggregation, was stimulated by the probe. It has great repeatability, able to obtain quantitative results and show a mapping approach for ablation boundary detection at a clinically relevant depth. VShare can also be applied in evaluating tissue stiffness and final ablation size after RFA. While on the one hand, ultrasound presents a number of advantages in RFA, it also presents some potential pitfalls, particularly because it's highly influenced by the operator's ability to perform it. It is impossible for an ultrasound expert available for each procedure. Is there a way that we could gather everyone in the OP room without a scheduled delay? Sure. Thanks to the inbuilt flying sonar, the V10 allows surgeons a shortcut to remote diagnosis with ultrasound experts who are not in the surgery room. Simply make an appointment with them with flying sonar before the surgery. After the anesthesia is performed, surgeon could start live consultation with ultrasound experts face-to-face, allowing them watch scanning technique, scanning images, locating the tumor, and give suggestions in real time. The improved accuracy of VShare in quantitative evaluation of the boundary of liver lesions during and after RFA, combined with the inbuilt flying sonar for real-time remote diagnosis with ultrasound experts to secure the surgery success with less complications. V10 allows the RFA intraoperative accuracy truly possible. The recent study suggested that more than 70% of musculoskeletal injuries could be accurately and completely evaluated at the point of care using ultrasound and X-ray together instead of MRI. It means using the lower cost and a safer approach of ultrasound first for MSK could save $6.9 billion during 2006 to 2020. Ultrasound is a perfect tool for screening patients with shoulder and elbow problems in the primary diagnostic setting. V10's portability allows it to be easily transported between various outpatient locations. V10 is the first portable ultrasound with VLucid technology, which integrates the new adaptive beam correction technology with high-performance hardware architecture, delivering outstanding 2D images and enhanced color performance. A torn tendon in the shoulder can be easily diagnosed, no matter which tendon is affected. Image almost the whole body and almost any body. The 3 to 10 MHz axon linear transducer provides penetration for deep structures, such as thighs, hips. Other transducers image up to 23 MHz for stunning superficial detail. The hockey stick transducer, especially for conditions include joint swelling, inflammatory conditions like tenosynovitis or tendinitis, trigger finger, ganglia, and osteoarthritis. The low-velocity color detection VFlow effectively reduces color overflow based on the new algorithm to deliver enhanced spatial and temporal resolutions in microvascular presentation, such as for the adhesive capsulitis of the shoulder. Ultrasound needle guidance is also beneficial for both the clinician and the patient. When performing joint injections, ultrasound guidance can be a very good tool in patients whose anatomy is different to usual. For example, in post-trauma cases, it is particularly useful when injecting into the bicipital groove, where the biceps tendon is located. As this part of the shoulder cannot be palpated, the auto needle enhancement function allows a straightforward needle approach with the needle visualization automatically adjusted to the target. The procedural accuracy is improved, of course, but also creates a better experience for the patient. In addition to its use as a screening tool, ultrasound is highly beneficial for post-operative evaluation of the patient, enabling progress to be monitored. For example, following a rotator cuff repair, ultrasound can be used to periodically check that the tendon remains attached to the bone and to identify any potential re-tear. Ultrasound allows the physician to show the patient exactly what their shoulder looks like, pointing out the tendon and the bone. When they can see that everything is good, they have confidence in their shoulder. I almost forgot to mention, V10 is inbuilt with one of the most extensive tutorial modules, with up to 68 anatomical parts, including shoulder, elbow, wrist, and knee, with vivid scanning animation and real-time scanning plane, supplemented by basic clinical knowledge, greatly increase the confidence in the initial learning process. V10, the first portable high-end color ultrasound with VLucid technology, takes the point-of-care ultrasound to high altitudes. The availability of easy-to-use, learning tutorial, outstanding imaging performance enables V10 to deliver enhanced diagnostic efficiency and better patient care with real-time scanning and to communicate with patients for both novices and ultrasound experts. It lives up to the expectations for the ultimate sports ultrasound.
Thanks, Chao-Chi, and also thanks to all my colleagues who work behind the scenes to make today's introduction possible. As a conclusion, both R700 and VINNO 10 are designed upon the powerful VLucid technology to address today's clinical challenges for global physicians. Either of them will be the right system for you for scenarios, no matter which. At VINNO, we keep asking ourselves how we can provide better using experience of ultrasound with more innovation. We hope you can feel our core beliefs with the product we present to you today. Innovation for a better life. Thank you for taking the time out of your busy day and joining our event. Please also follow us on social media and visit our website to explore the potential of sonography. Have a nice day.